Let us start the class. Today our speaker is Dr. Asutosh Kumar. Today's topic is abdominal CT scan. So you can proceed.
Good evening, everyone. CT abdomen is a topic which is very important for EDIC 2 exam. And in this, what the mind does not know, the eye cannot see. So if you don't know what is the pathology in the given CT abdomen, you cannot tell what is the pathology and what will be the treatment. Suppose there are pneumatosis intestinalis, air in the wall of the intestine. If you don't know how it looks like, you cannot give the answer. So basically there are three types of images on the CT. There are some coronal images, sagittal views and axial plane. We all know the anatomy. I am not going in detail. So basically there are two types of CT scan. Basic CT scan in which you can imagine you are standing at the foot of the patient's bed, looking towards their head. So in an axial image, usually CT abdomen are the axial images. So in this, anterior, posterior, and right and left. So on the right side there is a liver. You can see on the left side there is a spleen or kidney, whatever the structure is there. Or anterior and posterior, there is a vertebral spine. What is deal with the contrast? Can you appreciate the difference between the normal CT abdomen picture and the contrast enhanced? So kidney is a highly vascular organ. So you can see the very bright kidney on the right side and left side, and a little brighter the liver also, because liver is also a vascular organ. So organs who takes much of blood, much of cardiac output will take the contrast also. So they will be bright in color in the contrast enhanced images. So the systematic approach is that always begin cranial and gradually moves caudally. Likewise, access the structures from superficial to deep. For beginners, it is best to begin by following one organ and tracking it through the entire sequence. So if you are following the esophagus, then you should follow the esophagus, then you will get the stomach, then duodenum, like that. With experience, the next step to the follow organ that lie in the same transverse plane. In the same plane like spleen, pancreas, adrenal, kidneys. So you can also understand which structure are they in the given CT. As the CT tracks caudally, identify the appropriate anatomical landmark like celiac trunk, superior mesenteric artery, renal artery, aortic bifurcation. Follow the major vessels to assure that IVC and the aorta are intact and without major pathology, because sometimes you get the aortic dissection. So you should not miss those fatal diagnoses. In this axillary CT sequence, we will follow the esophagus caudally until it joins the stomach, and eventually the stomach will transition into the duodenum. It is best to view this sequence in the movie mode. Images are viewed as looking from the feet and right on your left hand and left on the right hand. So the air-filled density of the esophagus is outlined in this image. You can follow this down in the next several sequences. So this yellow one is the esophagus. Why this is black inside? Because air in the esophagus. Then in next movie mode, you can see this mixed with the, now stomach started. This is the stomach. And the highlighted circle is the duodenum in plane with the long axis of the body, the reason for different density, primarily fluid containing structure in this section. So blue one is the pancreas and yellow one is the duodenum and antrum. Okay. And then you can see the duodenum, antrum and the pancreas. CT of abdomen and pelvis with IV contrast. So you can see this is the coronal section, and you can see the hepatic flexor of the colon on the right side, splenic flexor of the colon on the left side. In between there is a transverse colon, and this bone is acetabulum, and this is pubic symphysis. These are the structures. Then you can see the structure of the heart. So this is the right ventricle, a triangular shape, and in round shape this is a left ventricle, and in between there is a interventricular septum, and this is the aorta, and this one is the esophagus. This is vertebral body, and air in the vertebral canal. So you can see the ribs. These are the ribs, and this is the inferior vena cava, which opens into the RA, then RV. Then this is aorta, and this is vertebral body, and in between the ribs there is a intercostal muscles. Then you can see this is the right ventricle, this is left ventricle, this is interventricular septum, this is the inferior vena cava, this is esophagus, and this is the sternum, and these are the ribs, and in between the ribs there is a intercostal muscles. This is vertebral body, and this one rounded structure is the aorta. Then interventricular septum, right ventricle, left ventricle, this is inferior vena cava, and this is aorta. Then the same structures you can appreciate: the esophagus, aorta, left ventricle, right ventricle, inferior vena cava, and the liver also you can see. So this is liver, inferior vena cava. Now inferior vena cava runs through the liver. This is an intrahepatic part of the inferior vena cava. This is interventricular septum. This one is the right ventricle. This is the left ventricle, and this rounded structure is the esophagus, and this rounded white structure is the aorta. Then inferior vena cava moves through the liver. This is the liver portion. This is heart. This contrast enhanced structure. The right, this is left ventricle. This is right ventricle, and you can see the aorta. So this is liver, inferior vena cava, heart chambers, left ventricular and right ventricle. Now this is rugae of the stomach, and this small structure is the spleen. Now spleen coming forward, and this is the stomach, and there is air in the stomach, and this is the splenic lobulation. It may be a normal variant of the spleen. This is aorta. This is inferior vena cava. Inferior vena cava on the right side and aorta on the left side against the vertebral bodies. Then inferior vena cava, aorta, stomach, liver, spleen. And this is the right crus of the diaphragm, and this is the left crus of the diaphragm. This is the T12 level, and liver, stomach, spleen, vertebral body, T12, aorta, inferior vena cava. This is the portal vein, inferior vena cava. This is the liver, and aorta, right crus of the diaphragm, left crus of the diaphragm. This is the stomach. This is the spleen. Then now colon. This air inside the colon, splenic flexor of the colon on the left side, and liver on the right side. The portal vein, inferior vena cava, aorta, spleen, vertebral body, right crus of the diaphragm, left crus of the diaphragm. Then a small left kidney is now appearing. Right kidney is on the lower side because of the liver structure. So in the initial section you get only the left kidney. Then in subsequent sections you will get the right kidney also. And this is the pancreas and left adrenal gland. This is a triangular structure. Over the left kidney is a adrenal gland. and inferior vena cava, aorta, portal vein, liver. Now you can see the origin of the celiac trunk, and from celiac trunk there is a splenic artery and the hepatic artery. You can appreciate because these are the contrast enhanced images. This is left kidney, then this triangular structure is the left adrenal gland. This is the spleen, liver, portal vein, inferior vena cava, aorta, vertebral body, splenic flexure of the colon. So these are the structures. Then this is the right lobe of the liver, this is the left lobe of the liver, portal vein, common hepatic artery, this is inferior vena cava, aorta, left kidney. Now you can see the differentiation between the cortex and medulla of the kidney. This is the spleen, and then you can see the splenic artery supplying to spleen. This is a kidney, left kidney. This is the L1 vertebral body and inferior vena cava, aorta, and this is the vein, superior mesenteric vein and splenic artery. This is stomach, splenic flexure of the colon, left lobe of the liver, right lobe of the liver. Then rectus abdominis muscles, you can see this is common hepatic artery. Now the pancreas is clearly visible. This is pancreas, and now there is a small structure coming out from the aorta. This is superior mesenteric artery, and this is the left kidney is quite visible. Cortex and medullary differentiation are there. This is spleen, splenic flexure of the colon. This is stomach, and this is the left lobe of the liver, right lobe of the liver. Then this is the rugae of the stomach. These are the, and this is splenic flexure of the colon. This structure is pancreas. You can see the pancreas. This is inferior vena cava, aorta, left kidney. This is spleen, right lobe of the liver, left lobe of the liver. Then you can see the right kidney also. Now right kidney is start appearing. This is right lobe of the liver, left lobe of the liver. This is the rugae of the stomach, and this one is the pancreas, left kidney, the spleen, splenic flexure of the colon. Then again the stomach is there. This is the pancreas, left kidney. This is the right kidney, right lobe of the liver, left lobe of the liver, splenic flexure of the colon, small spleen is there. So there is a aorta, then left renal artery and left renal vein supplying to the left kidney. This is right kidney and right renal vein supplying the right kidney and right renal artery. So right renal artery and right renal vein. So towards the right kidney. And this is the right lobe of the liver. This is left lobe of the liver, stomach. This is the spleen, and this is splenic flexure of the colon. Then this structure is the intestine. So now small intestine is appearing in the CT scan. This is left kidney, this is right kidney, right renal vein, right renal artery. This is aorta. Now you can see the gallbladder. So for the first time you can see the gallbladder in between the left lobe of the liver, right lobe of the liver, and this is left kidney, left renal artery, left renal vein. This is L2. And you can see the stomach, the air in the stomach. This is splenic flexure of the colon. This structure is the small intestine. This one is the left kidney, right kidney, and descending part of the duodenum. This is the descending part of the duodenum. This is the gallbladder, right lobe of the liver, left lobe of the liver. Then colon, this is the small intestine, left kidney, aorta, inferior vena cava, this is right kidney and right renal artery and right renal vein, descending part of the duodenum, and this is the descending colon. Now on this side, right side, there is a hepatic flexure of the colon and stomach, air in the stomach. This is small intestine, left kidney, right kidney, vertebral body, aorta, inferior vena cava. So this is inferior vena cava, aorta, colon, descending colon, left kidney, right kidney, and these are the intestine, loops of small intestine. Then on the sides of the vertebral body, you can see this muscle. This is 𝒔𝒏𝒆 major muscle. This is important to know because 𝒔𝒆 can be there in the exam. So if there is any abscess in the 𝒔𝒆 muscle, this is known as 𝒔𝒆. This is black portion in the kidney is the medulla, and the white outer portion is renal cortex. So this is right kidney, this is left kidney. These are the small loops of small intestine, and there's the air in the colon. So this is the aorta, inferior vena cava, ascending colon. You can see the haustra of the colon, and the difference between the haustra and valvulus coniventi is that haustra are not the completing the circle, but volvulus conniventis completes the circle. That's why this is only this type of structure is there in the colon. So you can see this is the inferior vena cava, aorta, right kidney, left kidney, 𝒔𝒆 muscle, 𝒔𝒆 major muscle. This is descending colon. This is hepatic flexure of the colon. Then the same structure. Now you can appreciate the colon portion. This is the colon, and inferior mesenteric artery is coming out from the aorta. This is the inferior vena cava, right kidney, left kidney, 𝒔𝒆 major muscles. These are the small intestinal loops. You can see the inferior mesenteric artery, inferior vena cava, and 𝒔𝒆 major muscles. You can see these are the 𝒔𝒆 major muscles on the sides of the vertebral body. This is ascending colon, this is transverse colon, this is descending colon. These are small loops of intestine, 𝒔𝒆 major muscle, aorta. This is inferior vena cava. So ascending colon, descending colon, inferior mesenteric artery, inferior vena cava, aorta. Now bifurcation of aorta. So you can understand this single rounded structure bifurcated into two rounded structures. So you can see now the right common iliac artery and left common iliac artery are divided from the aorta. So now there are two small rounded structures, white color contrast is there. So there are artery, right common iliac artery and left common iliac artery. This is descending colon, this is transverse colon, this is ascending colon. Then you can see the 𝒔𝒆 major muscle and right common iliac and left common iliac artery. This white structure is the iliac crest. This is descending colon, ascending colon, and transverse colon. So now you can see the bifurcation of the left common iliac artery. It is divided into internal and external iliac artery. So this has been divided into two, and this is the descending colon, ascending colon. If air is there in the colon, then this is a transverse colon. This is iliac crest, and this is iliacus muscle, and this is the rectus abdominis muscle. This is the descending colon or ascending colon. These are small intestinal loops. then right external iliac artery or right internal iliac artery, left internal iliac artery and left external iliac artery. So initially aorta divided into two, right and left internal iliac artery. Then both artery divided into two, right external iliac, right internal iliac. Then left external iliac and left internal iliac artery. So this bifurcation of the arteries, then you can see the sacroiliac joint and this anterior sacral foramina. You can see the small rounded structure, and this is the right internal iliac artery, right external iliac artery. Now they are moving apart, these arteries. So you can appreciate there are four artery, and there is a body of sacrum, this one, and this is the sigmoid colon and anterior superior iliac spine, ASIS.